Barium enema. Barium enema is a diagnostic procedure used to detect abnormalities of the colon or rectum. Let us discuss this in a much more detail. So, barium enema is a procedure that a doctor commonly prescribes to be done when they suspect a patient to be suffering from a disorder usually involving the large intestine and the rectum. It is a special type of a procedure wherein an X-ray of the large intestine is taken after administering a contrast dye into the colon. Now, usually, an X-ray of the intestine does not give a clear picture of any problem with the intestine. But since we use a dye, it coats the intestine and helps in better visualization of the intestine. Let's know the intestine a little better before we proceed. The large intestine, its main function is to absorb water and electrolytes and some nutrients from the food that we consume. The stool is already in the making by now, where all the waste product of the process of digestion collects and the water is absorbed from it to make the stool hard. Now the large intestine is almost the last part of digestive system. The intestine is divided into four parts: the ascending colon, the transverse colon, descending colon, and the sigmoid colon. The waste products moves across the large intestine in this order itself, and thus as it moves it becomes back from liquid to semi-solid to hard. If the large intestine fails to function properly, not only will waste product accumulate, but also fluid and electrolyte balance will not be maintained. Also, infection of the intestine can occur, which may spread to other parts of the GI tract. Now, a patient coming with abdominal problems may be prescribed to undergo barium enema procedure for the following problems. First, inflammatory bowel disease, a disease where the large intestine is inflamed without any specific reasons. Second, obstruction of the intestine. Here, the patient may not be able to pass stool properly. It may be caused due to a variety of problems requiring variety of treatment. Third, cancer or tumors of the large intestine. Fourth, abdominal pain in the lower part. Fifth, unexplained weight loss. Sixth, irritable bowel syndrome. And lastly, seventh, changes in bowel movement, which requires further investigation, can also be sent for this particular test. Barium enema is contraindicated in pregnancy, acute GI bleed, or active colitis. Caution is used for elderly patients. Coming to types of barium enema, there is single contrast barium enema and double contrast barium enema. In single contrast study, the intestine will be filled with barium sulphate and an X-ray is taken. In double contrast study, however, the intestine is first filled with barium and then the barium is drained out of the intestine and then the intestine is filled with air before taking the X-ray. The barium which was administered leaves a thin coat of lining on the intestine, and thus small growths or tumors or inflammation can be better visualized on this type of barium study than the single contrast ones. In single contrast study, the whole lumen of the intestine is filled with the barium, so polyps or growths cannot be seen on this study. It may only help in identifying obstruction, adhesions, etc. Fluoroscopy is also commonly used with this procedure. In fluoroscopy, the X-ray beams are continuously passed to give a moving image or video. Thus, you can visualize the intestine in real time as the fluid passes through it. Now, a question that may come to your mind as to why only barium sulphate is used. Why not any other dye? The reason is simple. Barium is an X-ray absorber and appears white on an X-ray film, which makes visualization interpretation easier. Coming to the procedure, the patient is given a change of clothing and told to wear patient's gown for the procedure. The patient is advised to stay on clear liquid diet for the whole day before the procedure. Some doctors may prescribe laxatives to clear out the bowel prior to the procedure. The patient will then be placed on their left side with knees bent to facilitate the administration of barium enema into the colon. A rectal tube will be lubricated and inserted into the rectum, and barium sulphate will be administered into the intestine through it. The patient is advised to take deep breaths during the administration of the enema to reduce the pain. A bedpan must always be kept ready in case patient cannot hold on any longer and needs to pass the stool. In single contrast study, the patient must not pass the stools until the procedure is over. But in double contrast study, the patient is allowed to pass some stool so that the intestine is only partially filled. After passing the stools, air is injected into the rectum to fill the intestine in double contrast study. Once the lumen is coated with barium, patient is positioned in various positions for taking X-rays. Various positions enables the radiologist to visualize the colon in different angles, which helps in better diagnosis. Once the procedure is over, the patient can be relieved. Most of the barium will be expelled through feces, and if there is any discomfort like abdominal cramps, etc., they will be relieved once the patient defecates or passes the stools. Patients are usually advised to drink lots of fluid as barium have a tendency to cause constipation. No special procedure is required to remove the barium from the intestine, but when required, an additional laxative may be ordered by the physician to aid in its excretion. Patient may pass white stools for few days after the procedure. The physician or radiologist will inform the test results to the patient, and the patient is then sent home. Now coming to the complications, even though barium enema is quite a safe procedure, complications like arrhythmia, bowel obstruction, hypertension, drug allergy and bowel perforation may occur. Patient is advised to inform physician of any discomfort or inability to pass gas or feces as soon as possible once they are discharged. So this is all in barium enema. For any further details, please leave a message in the comment section. Hope you find this useful. For more such videos, please like, share and subscribe to our YouTube channel, and see you soon.